Every year, Nigeria deals with cholera. And like clockwork, the government goes into action, urging personal responsibility from the public. Don't defecate in public, wash your hands, and so on and so forth. Treating symptoms and ignoring the disease. At least that's what my guest tells me on our program today. And as a bonus, he explains to us why it's not very smart to fill up a Ministry of Health with medical doctors. That's in our interview segment. Cholera is a disease of inequity. It targets the most vulnerable in society. We visit one of such communities in the FCT in our feature story. And as usual, we walk you through the major stories from Nigeria's seat of power on our Abuja Wrap. This is Dateline Abuja. Hello and welcome to Dateline Abuja. I am Kayla Magwa. Let's begin by updating you on the major stories in our Abuja Wrap. President Muhammadu Buhari is asking security chiefs to find more tactics to solve the security challenge, particularly in the northwest and north-central parts of the country. The president gave the directive during a 3-hour security meeting with service chiefs at the presidential villa.
From the meeting, we believe that the state in which these things are happening in Zamfara State and North Central is a source of concern. We discuss the need for urgency in our dealing with the bandits. We believe they are becoming a nuisance. They are killing people. They are doing what they like. They make careless statements. They say what they think they should say in order to solicit the kind of audience they will want from the society.
The president also attended the 47th annual general meeting of the African Insurance Organization. Though it was held in Lagos, the president opened the conference virtually from the State House. The president met with several state governors this week, including Governor Kayode Fayemi of Ekiti State, Governor Yahaya Bello of Kogi State, and Governor Dave Umahi of Ebonyi State, who used the opportunity to address State House correspondents on the clamor to zone the 2023 presidency to the southeast. The president also met with some international figures. First, he met with the Saudi Arabia Foreign Minister, His Royal Highness Prince Faisal bin Farhan Al Saud, who came to sign a memorandum of understanding to boost trade relations with Nigeria. The president also met the president of the Rotary Club International, Mr. Shakar Mehta, and his wife, Mrs. Rashi Mehta. President Buhari met with the leadership of the Nigerian Medical Association, led by the president, Professor Innocent Uja. Also at the meeting are the Secretary to the Government of the Federation, Mr. Boss Mustafa, Minister of Health, Dr. Ehani Rel Sage, and Minister of Labour and Employment, Senator Chris Ngige.
I request that the agreement reached in the meetings on the 20th and 21st August as captured in the MOU, which I have seen be rigorously implemented. This administration has a good track record of paying all debts owed to government workers, pensioners, and contractors. And we have even revisited debts left by past administrations once due verifications is done.
Staying with health, the president has approved the setting up of a health sector reform committee for the development and implementation of a health sector reform program for Nigeria. The committee is chaired by Vice President Professor Yemi Osinbajo. Meanwhile, Professor Osinbajo has condemned the coup d'etat in the Republic of Guinea, saying that coups have no place in 21st century governance. He stated this while representing the president at a virtual extraordinary session of the Authority of Heads of State and Government of ECOWAS member states on the political developments in the Republic of Guinea and Mali.
We, of course, are greatly saddened by the events of the 5th September 2021, which culminated in the arrest and detention of President Alpha Conde, the dissolution of the Guinean government, and the suspension of the constitution, a military takeover of the authority and affairs of the government of Guinea. And we join all well-meaning global leaders to express in the strongest terms the condemnation of the Nigerian government of this unconstitutional change of government. a development that we believe could seriously destabilize the Republic of Guinea. We fully endorse the recommendations made by the President of the ECOWAS Commission, but let me also state unequivocally that the unconstitutional seizure of power in any shape or form is simply unacceptable. And that what happened in Guinea is a brazen disregard for the provisions of the ECOWAS Protocol on Democracy and Good Governance, which clearly states that every accession to power must be made through free, fair, and transparent elections. In finding a lasting solution to this development, we believe that the military junta must ensure the physical safety of President Alpha Conde and all those detained along with him.
In the meantime, the Vice President is urging Nigeria's elite to make responsible input in fostering national unity, stability, and creating opportunities for majority of Nigerians. He made this call in a keynote address at the Leadership Conference and Awards. The federal government has approved the national policy on the fifth generation 5G network in Nigeria. This is according to the Minister of Communications and Digital Economy, Dr. Isa Pantami, who addressed State House correspondents after the weekly Federal Executive Council meeting.
A memo in which I presented before the Federal Executive Council, which has also been approved after deliberation. That is the national policy on fifth generation networks for Nigeria's digital economy, the national policy on 5G. So that policy has been approved by the Federal Executive Council today. And furthermore, the policy discusses the benefits to be attained through the deployment of 5G in Nigeria and in any part of the world, which includes like lower latency, like larger capacity, and also like higher data rate. These are the three major benefits of fifth generation. And in a simple language, we can say it will open many opportunities economically, academically, educationally, and even in health sector. And it will also support our security institutions, particularly in areas where they need high quality services.
The Chief Justice of Nigeria, Justice Ibrahim Mohammed, has asked 3 judges to appear before the National Judicial Council to show cause why disciplinary action should not be taken against them for granting conflicting ex parte orders. The CJN had summoned the Chief Judges of Rivers, Kebbi, Cross River, Anambra, Jigawa, FCT, and Imo State over the orders. Welcome back. As with every year, the rain exposes the inadequacies of the government. Harsh but true. This time, an increase in rainfall is bringing about a cholera outbreak in Nigeria, and this should not shock anyone. A country that ranks number 1 in open defecation, constant flooding due to blocked drainages, poor sanitary conditions is a perfect formula for cholera to thrive. We might not be doing as badly as countries like Yemen or the Democratic Republic of Congo, but we are well on our way there. This week, we visited the Bazango community in Kubwa. Please watch this.
Bazango is one of the communities in Kubwa satellite town in Buari Area Council in the nation's capital. Residents who are mostly Gbagi, one of the original inhabitants of the Federal Capital Territory, are essentially petty traders and farmers. Unfortunately for them, the community is also dealing with active cases in Abuja in the latest cholera outbreak. Cholera is a waterborne disease, and the risk of transmission is higher where there is poor sanitation and disruption of clean water supply. The wrong disposal of refuse and practices such as open defecation endanger the safety of water used for drinking and for personal use. These lead to the spread of waterborne diseases such as cholera, and without potable water, sanitation and hygiene, Nigeria remains at the risk of cholera cases and deaths.
The Federal Ministry of Water Resources, called the WASHNOM, pointed out that 46 million Nigerians across all the states, including the FCT, defecate in the open. And this is very common, especially in Abuja here, as we can see people along the expressways, by the water sides in Abuja. And also at the transport hubs, that's the motor parks and markets in Abuja. We really do not see a lot of places of convenience, that is toilets and safe water. In cases there are, we also see that they are poorly managed. So you can visit that place and probably can get infected with any cholera or any water and sanitation related diseases.
According to the Nigeria Center for Disease Control, Nigeria has reported over 65,000 cases of cholera in the first 34 weeks of 2021, with over 2,000 deaths in 24 states and the Federal Capital Territory. The FCT has reported over 1,200 cases and 77 deaths. Of the suspected cases, the age group 5 to 14 years is the most affected group, while 51% of the cases are male and 49% are female. Government officials are in Bazango community as part of efforts to secure the buy-in of the people, especially at the grassroots, to address rising cases of cholera across the country.
Let me use this forum once again to charge all state governments, commissioners of environment, local government chairmen and councillors, and environmental health officers across the country to step up their sanitation and hygiene programs and activities to control and prevent further outbreaks and spread of cholera in our country. I also want to take this opportunity to assure the general public that the Federal Ministry of Environment remains committed to ensuring a clean and healthy environment for all Nigerians. This is a collective responsibility which requires concerted efforts of all and sundry. This is the way we can prevent and curtail incidences of cholera outbreaks.
The idea is to use traditional leaders as agents for the enlightenment efforts to address the poor hygiene practices in their area.
We all have our roles to play as well. There is the need to maintain personal and environmental cleanliness, as this disease is spread mainly through unhygienic personal and communal habits. I therefore call on our community, religious and traditional leaders, and various social and youth groups to leverage their positions of leadership in the communities to further enlighten and sensitize the citizenry on the dangers of this disease and the need to prevent its occurrence and spread.
The area council has a constitutional duty to protect and preserve the life and property of the citizen within its domain. As a responsible administration, we have taken a number of serious steps to stamp out further spread of the diseases beyond the communities already affected. For instance, we are currently engaged in intensive sensitization and education of residents across the 10 political wards about 5 basic cholera prevention steps.
In order to make Bazango community, Kubwa, Bari Area Council, and at FCT at large cholera free. Therefore, the community wish to tender our communal requests, such as follow: the providing of dumping sites to the community, AEDP to provide with the household dustbin and the communal ones. Sir, we want the clinic to be equipped and fencing, upgrading of our Royal Highness, creating job opportunity to our youths.
While good hygiene practices rest strongly on individuals, local authorities are promising to enforce sanctions on defaulters to ensure compliance henceforth.
My guest is Dr. Baba Mohammed, the Registrar of the Environmental Health Officers Registration Council of Nigeria. Why is cholera a recurring decimal in Nigeria? Well, it's because the root cause has not been dealt with. And no matter how many people get cured, they go straight from the hospital back to the cause of the infection, their environment. Please watch this. Dr. Mohammed, welcome to Dateline Abuja.
Thank you for having me.
You know, the last time we spoke, you were talking about preventive measures, which is one of the issues we have in Nigeria. At the time, I remember that you said the reason why we have recurring outbreaks of cholera and meningitis and you know, all of these diseases that come every year, especially when the rains come, you said it's because we ignore the preventive measures. And I also remember that you're in charge of environmental exercise, that the weekly environmental exercises that we used to have in this country, which has stopped in many parts of the country. These days, people do it by themselves. Talk to us a little bit more about that and the impact ignoring this sector has had on our health systems, especially when it comes to outbreaks.
Thank you very much. You know, one beauty about public health measures, if you are able to get it right, you see the indices of the diseases going down. And for the pattern of the cholera in Nigeria, if you look at from maybe last 5 years, you see more states are getting affected with the outbreak each and every year. And what signifies is we are not getting it right. Because if we are getting it right, we should have addressed this outbreak. Mark you, cholera is a seasonal disease. Because if you look at the way the outbreak normally manifests in Nigeria, once the rain set in, you see the evidence. And why is it happening this way? It's because of our poor sanitation behaviors. You know, when you go to even our bigger cities, you see how people are defecating outside. And you know one thing about the environment, whatever you give to the environment, that's what the environment is returning back to you. So once this rain set in, you see the rainwater will wash out the fecal matter into our bodies of water. And this body of waters is used for drinking by some communities. Some are using it for irrigation. Some are using it for also domestic use. And that's why for you to curtail this outbreak, you need to invest in building sanitation infrastructure.
Such as?
Such as ordinary toilet facilities in public places. Because as humans, you must answer the call of nature. And that's why in organized society, you see there is a standard. You cannot build an event center without providing toilet facility. You cannot also have a gathering without also providing that toilet facility.
Even a wedding.
Even a wedding.
In public, if
yes.
even the wedding was outside.
That's public health requirement. And you see, let me, for the sake of emphasis, for us to really address this issue, we need to bring back this sanitary inspector of all to his rightful position. Why am I saying this? Because the sanitary inspector that came with the colonial masters came because they know the importance of preventive health. And that's why the sanitary inspector is placed as the first measures of prevention in the health system. That's why when they came, they first established the School of Hygiene in our two regions, one in Ibadan, the second one in Kano, one at Aba, when there is no university in Nigeria teaching even the medical doctors. Because they won't take the issue of preventive health. And you see, what we are suffering today, we must go back to the rudiment.
You're from the school of thought that believes that our health systems are more curative in their thinking
Yeah.
as opposed to preventive.
Yes.
And I remember that this conversation had to do with the fact that, most of our ministers of health, even our present minister of health, is a doctor.
Yeah.
And once we have people who cure diseases in places of authority when it comes to health, they will look at curative measures as opposed to preventive measures.
Yeah.
Is there a solution to this? Because it's going to be a hard one to be able to say
it's not
they should take them out. No, why not just incorporate?
No.
Is there a way out of this?
Yes, there must be a way out, because what we are looking at is a vicious cycle. Today, I am sick. I have gone to the hospital. Government is spending so much money to manage the patient in the hospital. But after management, what happens? You return back to the same environment. You acquire
the same sickness.
The same sickness. Then you go back. So the solution is, how can we break the vicious cycle? And how we can break the vicious cycle is, one, when you look at the cholera, for example, is transmitted through what? Contaminated food, contaminated water. How can you avoid the contamination of food? How can you avoid the contamination of water? There is solution to it. And that solution is environmental health solution. One, you do what we call aggressive house-to-house inspection, premises inspection. Second, when it comes to the issue of food, who is responsible for the inspection of food from farm to table is the health officer, because he's the only person that can certify the premises itself by showing that all the necessary sanitary requirements are there. Also, the food handlers, he is responsible to also certify that they are fit to handle food for human consumptions, and is also responsible to also look at the condition of the building, the siting of the building, and everything. Also, it is the responsibility of the health officer, as the doctors are managing sick patients, it is his responsibility to also manage contaminated water sources. Because if you want to site a well today in our community, there is public health requirement. You must site the well 300 meters away from any source of pollution. And if there is a cholera case, like what happens in London, the first outbreak of cholera, who is responsible for curtailing it, or what is responsible? It's contaminated water pipe that has linkage with the sewer line. And when they eliminate that water source, the outbreak went down. Now, I'm asking you, yes, government is spending so much money to manage the cases of cholera. How much are we spending at the local government and at the states?
Well, Dr. Mohammed, I am not looking forward to having this conversation with you next year. Hopefully, enough of the work that is being done right now will be enough to ensure that we don't have another cholera outbreak next year. But you do have your work cut out for you between now and then. Thank you so much for being with us on Dateline Abuja.
Thank you very much for having me.
There used to be local ways to trace the source of a cholera infection. The environmental officer would put kerosene in the toilets in the area, one after the other. And the day the water source smells like kerosene, they will know that that toilet was the culprit. It does feel like a no-brainer to just bring back environmental health workers and get them to work together with our medical professionals to fight cholera once and for all. What's the holdup? Don't we want to stop the death by cholera? Well, while the government tries to figure it out, it is important to note that this is your health, your life, the lives of your family members. So keep yourself safe. Ensure you have safe drinking water and keep your environment as clean as possible. Nobody should be dying of cholera in Nigeria in the year 2021. Nobody. That's Dateline Abuja this week. Remember to let us know the happenings in your neighborhood using the social media handles showing right now on your screen. Thank you so much for watching. I'm Kayla Megwa. See you next time.